Hello, today's video topic is how long does it take to recover from a normal fistula surgery. This is a question usually people ask. Okay, I got undergone pile surgery or fistula surgery or fissure surgery. How long does it take to resume a normal activities or to recover completely, because they want to resume their activities or go to the work, to join the gym, all these things they'll ask. Because of this only they usually postpone the surgery. So how long does it take? Generally, if you ask, 2 to 3 days. After 24 hours, completely you'll be out of this hospital, and you can resume back and completely recover within 2 to 3 days. But depends upon other things like patient's age. Suppose very young people can recover very fast. Old people, it may take extra another 1 or 2 days. How they presented, like as an emergency or abscess formation with a discharge, like acute condition, they come as an emergency. Then again, the days, instead of 2 to 3 days, extra 1 or 2 days can happen. But the discharges from the hospital is always one or 2 days. The recovery, I'm talking about once you go back to the home, it may take another extra 2 or 3 days. And the general conditions, like the patient, suppose there is a very obese patient, so the recovery can delay by another 2 or 3 days, or constipated, again it can get delayed. And so the diabetic and uncontrolled diabetes especially, and the wound healing may get delayed another 1 or 2 days. And what is the reason for the fistula? It's a very normal, uncomplicated fistula, the recovery is 2 to 3 days. If it is a complicated, or the reason is either because of the TB or inflammatory bowel disease or cancer or some other reason, then it may get prolonged another 2 to 3 days. And what type of surgery? If it's a regular conventional surgery, probably it may take extra 1 or 2 days. If it is a latest surgery, or if it is done by fistula plug or sitons, the type of surgery also makes the recovery. But generally 2 to 3 days, and you will be out of the hospital after 24 hours. After the 24 hours, usually 1 or 2 days. This is one. Then once you become very normal, you are taking normal diet, normal activities are resumed, and you have joined your work, everything. But even then, after that, see, generally if you have a wound, if you have a cut here, then when it heals, there will be some amount of discharges, wound discharge, water, or even the clotted blood, or tissues, all will come. The same way, it's in the anus. When it heals, these waste materials can come. So there will be some amount of discomfort, or maybe or some watery thing. It will be there for another 4 to 5 days generally. That's all acceptable, because it's in the center of everywhere. If you're sitting for prolonged, if your job is sitting job, or you drive 2-wheelers too much, or you're car driving too much, or your job is sedentary, and the healing when it happens, so there will be, it won't be pain, nothing, you will have recovered well, but in spite of that you may feel some amount of discomfort. This is all accepted. And so generally fistula surgery, the recovery, discharge from the hospital is 24 hours and another 2 to 3 days for complete recovery. And for other people, complicated age, all these things, maybe extra another 2 to 3 days. Thank you.